This is WFYI News Now. It's August 6th, and I'm Abriana Herron. On today's show, a new report shows so-called tongue-tie surgeries may be overused for babies. U.S. Secretary of Transportation Pete Buttigieg visits Indiana and highlights the state's role in the future of electric vehicles. And a federal judge ruled Indiana should stop charging premiums to people on its Medicaid expansion program known as HIP. The state says this could put people's coverage at risk.
Indiana disagrees with the ruling and believes these actions have unintended consequences for our program.
Those stories coming up, but first, the Indianapolis International Airport will receive more than $26 million from the latest round of federal infrastructure funding. Indianapolis will use the money to improve runways. One runway reconstruction project is at the center of the airport's goal to increase cargo and commercial airline traffic. The grant from the Federal Aviation Administration is part of larger infrastructure airport investments that have been awarded to 129 airports across the country. Indianapolis's airport has received $146 million in total for airport infrastructure improvements. Tongue-tie release is a medical procedure that involves cutting the thin tissue that connects the tongue to the bottom of the mouth. The procedure can help certain babies with breastfeeding, and some say it prevents future problems with sleep and speech. But a new report by the American Academy of Pediatrics found that tongue-tie surgeries may be overused for little babies. Side Effects Public Media's Farah Yusri has more.
Babies can be born with a tongue that's tightly tied to the bottom of their mouth, and in severe cases, it can cause problems with breastfeeding. A surgery known as a tongue-tie release can help, but according to a new report from the American Academy of Pediatrics that represents more than 60,000 doctors across the U.S., the tongue procedure is overused. One survey found a more than 800% increase in the number of tongue-tie surgeries between 1997 and 2012. But the Academy's report says evidence suggests that only a small fraction of babies actually need the surgery. The Academy recommends that families work with healthcare professionals like feeding therapists and lactation experts who can help with the early days of breastfeeding before turning to the procedure. I'm Farah Yusri.
U.S. Secretary of Transportation Pete Buttigieg highlighted Indiana's role in helping build the future of electric vehicles Friday. Indiana Public Broadcasting's Tamoria Cunningham reports the secretary visited several facilities in Howard County.
Buttigieg toured an electric vehicle plant set to open in Kokomo. The plant is a joint venture between carmaker Stellantis and Samsung. It's expected to open next year and create more than 1,400 jobs. Buttigieg says the best way to secure good-paying careers in America is by building electric vehicles and the components that go into them.
We are working to ensure that America leads in building that electric vehicle future. And we're working in ways that make sure the Midwest is the center of it.
Last month, the federal government awarded Stellantis $250 million to produce EV components at its Kokomo facilities. The money is part of more than $1 billion awarded nationally. For Indiana Public Broadcasting, I'm Tamoria Cunningham.
And for our final story today, around 40 states plus D.C. have expanded Medicaid to cover more people with low incomes. Indiana is one of them, but the state says its Medicaid expansion program may be at risk, along with the health insurance coverage of hundreds of thousands of people. For Side Effects Public Media, Abigail Ruman reports a federal ruling found that some aspects of how Indiana handles its program may violate federal law.
Mulugeta Wolf is one of the people on Medicaid in Indiana. He's been on the Healthy Indiana Plan, or HIP, since earlier this summer, and he's unsure how long he'll be able to stay covered. He rifles through a stack of letters he received from the state Medicaid agency.
If you're not following your mail, you will miss a lot of that stuff. If you're not carefully going through your mail and reading the letters they send pretty thoroughly.
One of those pieces of mail was sent at the end of May when Wolf enrolled in Medicaid. It explained he would have to make a monthly income-based payment, like a premium, starting in July to keep his coverage.
It just seems like a pointless payment to make us have to do, other than to, create a barrier for us so we get, so we don't get re-enrolled and stuff like that, because people are busy right now. People are busy trying to survive.
Medicaid expansion programs like HIP aren't allowed to charge premiums per federal law, but Indiana obtained a waiver, or an exception, which allows it to charge payments for additional coverage like dental and vision. Now, a lawsuit says some policies in the HIP program, including those payments, go against the objectives of Medicaid and violate the law. A federal judge agreed and ordered Indiana to stop.
At the end of the day, what you find is that these policies, they just result in people not getting enrolled.
That's Leo Cuello. He's a public policy expert with the Center for Children and Families at Georgetown University.
And indeed, that's what we see in state after state, study after study, where you look at what premiums do.
In Indiana, tens of thousands of people on HIP have lost coverage simply because they failed to make these payments. Cuello says even though the payments are income-based, they can pose a real hurdle.
So what prohibitive is really is different if you are living in poverty. It's not just about the administrative hassle, it's also the actual ability to do it. You might not have a credit card or debit card account. You might not even be able to have a bank account open.
The state says premiums ensure people have a stake in their health care coverage. Cora Steinmetz, the state Medicaid director, explained the state's stance in July.
Indiana disagrees with the ruling and believes these actions have unintended consequences for our program. The ruling creates uncertainty regarding which services are covered and removes authority for certain administrative aspects of the program's operation.
The state also says that if the federal ruling is allowed to take effect, they'll need to transition members to plans with less coverage. Tracy Hutchings-Getz is with the advocacy nonprofit Hoosier Action. She says the state's response sounds like a threat.
Really this tone of holding members' health care hostage if they didn't get their way.
Advocates and even the judge on the case say the state doesn't need to keep premiums in place. It was able to provide members with the additional coverage, even though it hasn't collected those payments since the start of the COVID-19 public health emergency. But Indiana insists the ruling threatens their ability to sustain HIP in the long term. Hutchings-Getz says it's unlikely the state will end the HIP program entirely because if that happens, it'll have a ripple effect on hospitals, providers, and employers who rely on Medicaid.
If HIP were to go away, it would be an unmitigated disaster for the people, the health systems, and the economy of this state.
For now, the state says people don't have to make payments. But for people on HIP, like Wolf, they're still confused and worried. Wolf says he hasn't received any communication from the state.
And just knowing about the trial, that's probably the only way I know, that's the only thing making me think I don't have to pay.
Things may change in the future as Indiana appeals the ruling and tries to keep those premiums in place. For Side Effects Public Media, I'm Abigail Ruman.
WFYI's Ben Thorpe co-reported this story, which was a collaboration between Indiana Public Broadcasting, WFYI, and Side Effects Public Media. That's all for today's episode of WFYI News Now. Our podcast is produced by Drew Daudelin with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music, and I'm your host, Abriana Herron. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.